I'm Dr. Patricia Delden. I'm a clinical psychologist. I'm a professor at the University of Michigan Department of Psychology. I'm Associate Director of the Depression Center, and I'm the Director of Clinical Training in the Clinical Psychology Program in the University of Michigan Department of Psychology. Everybody in the United States at some points needs some kind of support around mental health care, and there's no way that we could possibly afford that with traditional methods in which people come in and see a therapist for $150 an hour. There aren't enough. There's a great shortage of mental health care providers in the United States.
Everybody deserves access to affordable, feasible, flexible mental health care. And I think that kind of root mission or goal is really why I was first excited to be involved, and also why I continue to be really interested and invested in where Moodlifters goes.
It costs about $140 to $150 to see someone for an hour individually, and that's pretty expensive for most people, especially if you don't have insurance. And when we think about how we could disseminate Moodlifters, it could be much less expensive than that, and that's also wonderful.
And I took the very best of what we know from clinical science, from biological science, from psychiatric science, to figure out what aspects of everything that we know in mental health care could we apply.
It's a peer-based program, so that the ability for people who are not necessarily have their PhD or their master's in some type of psychology can run it successfully, I think is a huge difference from a lot of the other mental health treatments that we have, that people can really feel connected to the leaders because they've also gone through the program and worked through maybe some of their own things, some of their own struggles in their life.
When I entered the program, I measured at clinical levels for both depression and anxiety, and when I finished, I didn't meet the criteria for either one.
People are able to come to this group, and it's not that traditional psychotherapy setting. So for people that are maybe a little bit more nervous about it or don't have insurance coverage, or there's a lot of long waiting lists in their area, it's going to be a really good option for people to get care in a way that's a little bit different from traditional psychotherapy, but also is still based in research and gives a lot of that evidence.
It does not feel like therapy or what people maybe imagine therapy to be. You're not on the spot. There's not sort of this intense power dynamic between like a therapist or a leader and a group member. It feels very much like just a group of people talking.
I'm kind of able to troubleshoot before something even arises. So any skepticism or any self-doubt that participants have, I'm kind of able to counter that right away, because I not only experience that, but I also know the tools that they can utilize to do that for themselves.
We have developed mentally healthy strategies that people need to do each week in order to get points. So for example, we have 5 different domains. We have a body domain, a thought domain, an emotion domain, behavior domain, and a relationship domain, because we think those are the 5 essential aspects of mental wellness.
Give it a try. What do you have to lose? Is what you're doing now working for you? How are you feeling today? How were you feeling yesterday? How do you think you're going to feel tomorrow? If you don't go, that kind of a thing. Because for me, it was just nothing was changing. Nothing was changing. And it can be so easy, believe me, to do nothing if you've been doing nothing, or to think that nothing is going to make a difference when you've tried other things. But you're worth it. I mean, what would you say to a friend of yours is what I'd ask them, or a loved one.
We teach you healthy behaviors. Like, the first thing we ask people to do in the very first group is go out and do activities that they really enjoy, things that they might not be doing now, things that they used to do that they used to enjoy, because we know one of the most effective ways of decreasing depression is to get out and actually do activities, especially when you don't feel like it.
We have evidence from some of the pilot data that suggests that it actually results in a reduction in internalizing symptoms, so like symptoms of depression and anxiety. People have reported improved sleep, as well as improvements in physical health. So that can be anything from like exercise to just kind of physically feeling better, feeling like they can do more things.
Come to the first meeting. Just come to the first meeting, get a feel for what the program is going to be like, see how welcoming and warm that our leaders are, and just give it a chance.
So we think that Moodlifters offers a pretty radical and dramatic difference. Some people have called it paradigm shifting in how we view mental health care. It'll be low cost, easy access, destigmatizing, and so it's a matter of helping people meet them where they're at when they need it,